Hey guys, how you doing? This is Dr. Mike and Dr. Tina and Crosby. He didn't want to let you know how parenthood is. He didn't want to let us film this without being involved. So anyways, Dr. Tina woke up this morning, well sorry, yesterday afternoon, and go ahead and tell them what kind of pain you're starting to have now and what's happening. She's about 5.5 months along, or 22 weeks. Go ahead.
I started having pain in like my right SI joint, and then kind of like in the middle of like my glute going into the side of the hip.
So basically it's like a mild little bit of sciatica going on and some compression of the piriformis muscle, which starts to happen especially when the pelvis and different things start to open up and start to widen up, and those muscles again are starting to try to adapt to change for everything. So I'm gonna go through some things first. So what I'm gonna have her do is I'm gonna have her lay face down. Here, come here, Cross. Do you want to help me? Come over here. Go ahead and lay face down. No, you come over here. So the first thing we gotta do is we gotta relax this piriformis muscle. So one thing, if you're trying to do this at home, you can have your husband or significant other help you, but you want to take and just make a contact in about the middle of the glute. I'm going to do a little bit more specific. And with your hand, you're going to push across the body, hold that there, and then rotate this leg outward. And you just hold that. Bring it back. As you bring it back that way, this hand comes back this way. Push again in another spot. Now these are not very comfortable. They're pretty tender. So make sure you understand that. So don't get too aggressive with your wife there. She is pregnant.
Daddy,
What?
raining?
No, it's not raining.
Raining?
No, it's beautiful out actually. And if you have other kids, you'll probably have interactions like that going on too. Now a lot of times we can get out here on the hip socket, right by there. We can make contact there, do the same thing. That gets really tender too. Make sure she's breathing, because this gets really uncomfortable because these are really tender. But what's happening here is these muscles are starting to spasm, and that sciatic nerve comes right down from the back, right down the butt cheek there, right down the middle, down the back of the leg. And it can start to get compressed. And when that starts to get compressed, that's going to start that sciatic pain. This usually, we do start to see this around months 4, 5, and 6. Usually we start to see the sciatic pain starting, so it's not uncommon. But you got to get those muscles to release off that sciatic nerve. Otherwise, you're going to get more and more compression on that sciatic nerve. Sciatica is going to get worse as the pregnancy gets worse. Now I'm going to have her flip over on her back for me. How'd that feel?
Oh, I mean, it hurt, but it feels good.
It's one of those hurts so good. It's tough love. So now what I'm going to have her do is I'm going to have her bend this knee up because her right side's the worst. Now I'm going to have her take this one here. Now what I'm going to have her do is early on in the pregnancy, she'll be able to do this. As the stomach grows, I'll show you a variation for that. And she's just going to pull it to her chest. Now, she can take this hand off and grab her knee and pull and angle the knee a little bit more, and that's going to kind of travel that stretch across the buttocks there and also help to relieve that sciatic nerve. What's up, Cross? Hey, be nice. Sit, sit. Now, if she's further along in pregnancy, she'll leave this knee down And she'll just grab this knee right here, and she'll pull it at a 45-degree angle to this opposite shoulder. The whole time taking deep breaths, inhaling, exhaling. Yes, sir. Brent, he's not here yet. No, not yet.
They're working.
Yep, he's done working for a little bit. And so what this does is this actually stretches that sciatic nerve the same way as the other one. Now, one last stretch that she can do is she could lay on her side, face towards me. And take this arm and extend it back this way, and take this leg and hang it off the side of the couch, table, the bed, whatever she's on. If you need more stretch, your significant other, your husband, can just put his hand right here, put the other hand behind the knee, and just very lightly, it doesn't take much force at all. Hold that for about 10 or 15 seconds, let it relax, push down again for about 10 to 15 seconds, let it relax. Go ahead and sit up. She said, yeah, give me a second. How'd those all feel?
Good. They actually felt really good.
Yeah, so what that does is that helps relieve that compression that's happening to the sciatic nerve. It also helps relax those muscles, especially around the pelvis and the hip, which allows it to all open up and allows for greater comfort, greater ease. I'm also going to take her and adjust her lower back to help keep that moving and get that freed up, so that way that won't be any interference there as well. If you have any friends that are pregnant or having a baby, like it, share it, comment, tag them in the comments so that way they can see this video. Thank you and have a great day.